Good morning, everybody. It's 8 o'clock. Can I welcome you to this meeting of the People and Health Scrutiny Committee on the 14th of November. I'm Tony Coombs, the chair of the committee. My acting vice chairman at the moment is Laura Beddoe. Remember which surname to use this year.
Sorry, Laura, stop being
So with that, I will go straight into the agenda proper. Do we have any apologies for absence, please?
I've not received any apologies, but Councillor Jane Somper and Robin Lake are joining online.
So, good morning, both. Good to have you here. And also, if I can welcome the officers that are online and our guests as well. Very pleased to see you this morning. Do we have any declarations of interest from any members of the committee? Okay, so as usual, if something becomes apparent during the meeting, raise it when you become aware and we'll deal with it at that point. Okay. The minutes of the last meeting, as you will be aware, have not been issued yet. They're not ready, so we will have them at the next meeting. It's partly because of the short timescale between the last meeting and this one. So we will deal with that next time. Item 4 is public participation, and we have no questions from the public. Item 5, we have no questions from members, and 6, we have no urgent items. So we can go straight on to the substantive agenda for this morning. And the first item is the Safeguarding Adults Board Annual Report. So the working group has already received a presentation on the report and asked questions. And Councillors Jane Somper, Laura Beddoe, Carl Wood and Sally Holland. Sorry, Sally, I forgot your first name for a moment. We're all part of that working group. But I understand that the independent chair, Sian Walker-McAllister, will be presenting the report to us. Good morning, Sian.
Good morning. Good morning. I hadn't come thinking I'd be presenting the same presentation today, which I presented to the 4 councillors. Perhaps to, I'd assumed, I'm happy to do the presentation, but I'd assumed that we would perhaps go straight into questions following any issues that councillors who attended that meeting wanted to pursue further. And I'm happy to do either.
That's fine. If members are happy then, because we've all had the report. So any members on the working group, is there anything that you wanted to raise as part of this committee that you feel we need to be more aware of?
No, I don't think so. I think, you know, we had a good opportunity to discuss during our session with Sian. And there was nothing that stood out as sort of headline that we felt this committee should be discussing or looking at.
Okie dokie. I did highlight a few things when I was reading through it, but if the working group is satisfied, the only comment that I think I would make, when you were looking at the adult reviews, and you were talking about the transfer of electronic records between GPs. So in different UK countries, it's really difficult. So it was England and Scotland and so on. And you talk about that the issue has been escalated by the regional chairs network. But I almost think it needs to go further than that. I think it needs to be raised with MPs and at government level, because I don't think anything will happen unless it's pushed from above. And I don't know if there's anyone able to take it forward at that level.
If I may respond to that, Chair. So I used to co-chair the National Safeguarding Adult Board Chairs Network, and up until quite recently, and we met regularly with civil servants from the Department of Health and Social Care. I was instrumental in setting up an agreement where issues from safeguarding adult reviews would go through a process before being escalated to the DHSC. And I can confirm that having been through the regional chairs network, the national chairs network escalated to the department towards the end of June this summer. Of course, we all know there's been an election in between, and civil servants have not yet come back to the network with a comprehensive response. And indeed, the requirement of some regulation on transfer of health and social care records is something that's probably going to need regulation or amendments to regulation and or legislation. So it may take some time. My colleagues who are currently meeting with servants at the DHSC raise it at every one of their 6 weekly meetings, and we anticipate having a response at our quarterly meeting in December. That's the quarterly National SAB Chairs Network in December. So it's very much on the national agenda. It's been supported by all regional and all national Safeguarding Adult Board chairs. So it's an issue that's been recognised elsewhere. And indeed, for me, I used to be, many years ago now, not over 9 years ago, I was a director of adult social services in Wales. And there was an issue particularly on the borders where hospitals might be, the nearest hospital might be located in England and the person might reside in Wales. So it's a common issue that's well known and been escalated on many occasions. We hope that regulation will be introduced to address the matter.
Okay, that's really good to hear. And I suppose a similar question would be on the South West Ambulance Trust, where they talk about a manual referral system handling 51,000 referrals.
Okay, so I've been working with the South West Ambulance Trust from the regional network perspective, and SWAST also attend our Dorset Safeguarding Adult Board, because NHS Dorset in the whole of the Southwest region is the integrated care board which commissions the ambulance service. So they always have close contact with our board. The SAB has received an update from SWAST on the Safeguarding Referrals Management Plan. And I'm assured, following communication from NHS Dorset, Simon Hester, their head of safeguarding, who in fact used to be head of safeguarding in the ambulance service as well prior to this role. And he feels he's content that SWAST are using a robust risk assessment and management strategy to mitigate risk whilst resolving the technical issues around the manual records. So we will continue to raise that with SWAST at every meeting, and SWAST is a member of our board going forward until the new technical system is in place to make sure that records are electronic.
I'll come to you in a second. I think for me, it's just assurance that it is coming, but do you have any timescales?
Timescales. I mean, the timescales were that it was going to be introduced a couple of years ago, and there was an interim measure put in place. But can I say that SWAST has recently undergone complete transformation in its safeguarding area. Significant resource has been put into SWAST to make sure that safeguarding referrals, the legislation, the regulation is understood well by ambulance service staff. And I've met with the head of the ops director who is responsible for that at a regional level, and meet regularly with the head of safeguarding in the service now. So I feel confident and assured, but I don't know yet when the new system is going to be in place. And I guess they're waiting for the funding to get that done, as are many NHS trusts in terms of new patient record technology that needs to be implemented.
Okay, thank you very much. Julia.
Thank you. I'm Julia Ingram, Corporate Director for Adult Social Care Operations. Just in relation to the first point, which was about the GP records transfer, if Scrutiny would like, we can raise it with SLT and ask if they can use their MP meeting to raise the profile of that through the council as well.
I think that would be helpful because it's to everybody's benefit. across the country that something like that is resolved. Thank you.
And perhaps I could add to Julia's comment that if the MP would like to, any of the MPs would like to meet with me together with officers to go through that in a little more detail, I'm really happy to participate.
That's fantastic. Thank you very much. We'll put that in train. Chris.
Yeah, good morning. Councillor Chris Kippax, Yepminster Ward. Morning. Just a couple of questions. The reference, well, the reports in the annual report from prisons, which I was interested to see, and just ask about how that relationship is developing with those services.
Thank you for asking, Councillor Kippax. It's been a really important piece of work, and the Dorset and BCP Safeguarding Act, well, it's Dorset because the prisons are in Dorset, but we, as you know, we meet jointly as boards, have been leading on this nationally, in my view. I come from having chaired boards in London many years ago, where there was a lot of work done with prisons in London and with the prison service to improve relationships with safeguarding, and wanted, as soon as I arrived in Dorset, to start establishing those relationships so that the engagement of the prison staff at our board meetings was more meaningful, and that the board really clearly addressed the concerns of the prisons whose staff do feel quite isolated in dealing with some quite difficult situations. So along with one of your senior officers, Karen Mayer, last year on September the 4th of 23, we attended HMP the Verne and Portland Prison. And in August this year, we spent some time at spent a whole day at Guy's Marsh. Arising from that, we've done some work with senior staff in the prisons and probation service, with the probation service reset at the centre of that as well, to begin looking at how prisons have a better understanding of escalating issues and problems, rather than thinking they're never going to get through to adult social care services, or they've only got to deal with the health and care provider within the prison. So we clarified some points of contact and escalation of issues, and used some case examples of prisoners who had significant health and social care needs. And as you know, under the Care Act, the local authority is required to ensure that those care and support needs are met for prisoners within prisons. What we've also done is, because our second meeting happened in the midst of the new government's programme known as SDS 40, where prisoners are being discharged after 40% of their time that they should serve, as opposed to the 50% that had been to free up space in prisons, is we've done a lot of work with our housing providers, and Dorset Housing, under the leadership of Andrew Billany, we can see in the corner of the room here, has done significant amount of work to support us in that endeavour. And the prisons actually have housing liaison people who are working to ensure that prisoners on discharge are rehoused and settled appropriately. For me, this is an issue not only of safeguarding, because of prisoners having significant health and social care support needs and meeting the criteria under the Care Act for safeguarding interventions should there need to be, but also it's a community safety issue, because when people are settled, they then no longer reoffend, or it's less likely that they will reoffend. So we've been working very closely with prisons and probation. And in January, we have a meeting of the annual meeting with our housing. There's more than one meeting, but it's an annual event with our registered social housing providers. And a key focus of that meeting is going to be accommodating people on discharge from prison and working within the criminal justice system and safeguarding. So I think we've done a pretty robust kind of piece of work, and will continue to do so, to ensure that we support the prison staff and support people who are incredibly vulnerable, as well as having been perpetrators of crime, to settle and hopefully to begin to have a positive impact within the communities that they live in.
Thank you very much. Does that answer your question?
Yeah, it does. I've got one more, if I may. So quite separately, you're presumably, well, Safeguarding Adults boards will need to be cited on the deaths, very unfortunate deaths of the 3 residents in the care home in Swanage at some point, I imagine. It's obviously very early days yet, but could you just explain for me, remind me perhaps of the process by which you would eventually, need to sort of engage in that?
Okay, thank you very much. So, the Care Act is very specific that it requires is a statutory duty of a safeguarding adult board to commission a safeguarding adult review when it receives a referral that somebody in its area has died as a result of neglect, abuse, or harm, and because of their care needs, were unable to protect themselves from neglect, abuse, and harm. So we await a referral to our safeguarding adult board subgroup, and when we have that referral, if it meets all the criteria, that the person, that there was more than one agency involved, that there is learning, and a safeguarding adult review is about learning, not about apportioning blame. We will then commence the work in commissioning a review and using our statutory powers to ensure that all agencies working in the public voluntary community sector across Dorset learn and take account of what happened to ensure that doesn't happen again.
Excuse me, Chair, may I just come in?
Yes, of course, go, Julia.
Just to make you aware, we have got an open and active safeguarding Section 42 inquiry process on the home, and it is still a criminal investigation, so information is limited. But one of the actions we take and we took early on was to notify Sian in her role as the independent chair of the board of the incident, and we would expect her to have that information at a high level because of the nature of those particular concerns.
Great, thank you.
So I think it's a case of due process is working its way through. Everybody is aware, and at the appropriate times, things will be brought forward if they are appropriate.
Thank you.
I was going to introduce the next paper as a nice segue from the discussion on the prisoner release scheme. You sort of
sorry.
That's fine. Anyway, thank you very much for the annual report.
Thank you, and I appreciated meeting with the 4 members and having the opportunity to go into it in a little more detail as well. Thank you very much.
I think that sort of way of working is always very helpful.
Yeah.
Thank you.
Bye-bye.
Okay.
Bye.
So moving on to item 8, which is the briefing note on the prisoner early release scheme. It's fairly straightforward. Certainly in the briefing, we didn't have any questions to raise on it. Do any members have any questions on this, or are you quite happy? I think it's fairly calm.
Yeah, Councillor Crowwood, Gillingham Ward. Just a quick question about, I see there's a review after 12 weeks to ensure all required actions are carried out. Is there any further review of these things beyond that, or is that the only kind of review we're
Thank you. Andrew Benny, a corporate director housing community sector for that. It's one of those it depends questions. I think they will review after 12 weeks, and what my understanding is if all's running smoothly, then a judgment call will be made. But I can check on the absolute detail of that. But that's the one fixed review period, the 12 weeks, and then they'll take a view. Then if there's extreme cases that there's a reoffending, and that done a different course. Chair, can I also I think Sian's hopefully answered most of the things I was going to raise, but there is just to give committee assurance that whilst there's only 2 early releases within the council area, this is fairly tightly managed, and I'm pleased that she's given me very well praise back with Sian. It's good and helpful that the safeguarding board is looking across the piece along health, probation, social care, but there's fairly tight arrangements about phrasing this as we go. The thing I wanted to stress in the notes was this is business as usual, really. People are released from prison all the time. The early release in itself has had relatively limited impact, but we're keen to make sure we're as tight as possible as a Dorset system on managing releases well. And I can indulge me one bit further. The scheme that Sian referred to, the accommodation for ex-offenders scheme, we're very pleased with. We're successful in getting two posts funded through government for that specific purpose, getting that release from prison managed well from a homelessness point of view, because too often people are released from prison and then turn up and don't have options. So with a bit of advice and guidance, that can lead to very good outcomes, avoid homelessness, get people into jobs, etc. Pleased with the outcomes from that, and we hope to continue that as quite a small aspect of our work, but it's pretty effective in minimising reoffending, but also getting good outcomes for the people being released. Long answer to your question. Thank you.
Thank you. Any more questions? So we're quite happy to note that. Thank you very much, Andrew. Moving on, we have the Corporate Complaints Team Annual Report for 23-24. And I'll be listening through this.
Thank you. I'm Tony Bygrave. I work as the Complaints Manager for Dorset Council in the insurance section. There's a few things I want to sort of highlight on this report. Hopefully everybody's had a chance to look at it already and digest some of it. And I want to just give a bit of background to take away some of the sensationalism that might jump out at you. I do need to point out it's the second highest number of complaints we've had since Dorset Council began. And I think that would be something that will probably resonate with people. But what I would actually say to start with is having a lot of complaints a bad thing? Does it demonstrate that we're actually transparent, we're up for the challenge, we're up for learning from it? I would be more suspicious of a council that had a really, really low number of complaints and weren't that transparent. And it's far better for me to sit here with a report full of really good learnings and actions and value that have come from feedback from people than to actually brush complaints under the carpet and not be transparent with them. So we should celebrate the fact that we have a fit for purpose and robust model for complaints management. That said, it is a high number. The Ombudsman last year gave us some really clear guidance on when a complaint is a complaint. So some of the service requests that were coming in with a little bit of extra energy, if you like, if it was a clear service request, the Ombudsman had given us a little bit more scope to actually resolve these things as service requests. So that accounts for the 13% reduction in complaints. It's not necessarily that people have stopped writing to us. That's not the case. But as I say, we need to get back to the fact that it's good that people can challenge. What is brilliant on here, and I want to dwell on a little bit, if I may, is the Ombudsman. Because at the end of the complaints process is the Ombudsman, and he's a critical friend to us. Dorset Council's relationship with the Ombudsman is excellent. There is a temptation to see their report that they uphold quite a large number of complaints that get to them. I would point out that only 7% of any of our complaints get to them at all. So of those complaints that get to them, the majority of them are in and around SEN provision. This is a national issue, I'm afraid. There isn't enough provision all the time for those that want them. There's other challenges as well in terms of communications, which sometimes can make one want to complain. We're working really hard to try and improve that. This year, the complaints for SEN have dropped right off, I'm pleased to say. So there are some evidence of it's there. But the fact remains we have upheld quite, of the stuff that went to the Ombudsman, we upheld a fair number of SEN matters. There are financial implications as a result of that. You'll notice for the third year running, something in the region of £40,000 has been paid from the council's coffers in relation to complaints that have come in, and that's for 3 years on the trot now. So again, that's something we're all really well aware of. We're working closely with the service to see if there's any early warnings, any trends, any tell the truth and tell it early type approaches we can take with some of these issues rather than wait for the complaint. Is there more we can be doing? An early indication this year seems to suggest that it is, and we're improving there. Not least of which, because Julia and Andrew are with me, I really want to point out how well our adult services are doing. There's a clean bill of health from Andrew. There was no cases upheld for adults non-social care, so that's brilliant. A very, very small number for adult social care are upheld. I think the learning from this is the Ombudsman had pointed out that maybe there was more we could do during the complaints process to actually satisfactorily resolve issues on the Ombudsman's behalf. The Ombudsman tell us, do our job for us. Maybe we didn't all the time. So I guess if there is anything we can take away from the social care side of things, it's possibly that we can do a little bit more through the process to demonstrate the learnings and the actions as part of our responses. Again, that's something that we're working with. I will take questions, so I will go on forever. I'm like Quentin Tarantino. Unless someone drags me away, I will carry on. But there's a big report, there's a lot in it. There's the code of conduct stuff in it. I guess the key message from the code of conduct stuff is you'll be surprised how few cases are really code of conduct breaches. Some of it, I think, might be misinterpreting the guidance, maybe using it for the wrong sentiments. So yeah, have a look at that by all means. Town and parish probably is the key message, I guess, from that. Of the complaints we get about councils, they tend to be more from town and parish than Dorset Council, but an extraordinarily low amount genuinely turn out to be breaches. So do take the complaint forms probably a little bit earlier than they might.
I think you've piqued somebody's interest.
Yeah, that's what goes.
Go to questions, Chris.
Thank you. I think I better ask them now because it's such a comprehensive report.
It is.
Yeah,
Councillor Chris Kippax, Yatminster Ward. Just a question about terminology, first of all. You talk about 117 approaches to local government ombudsman. Is that referrals?
That's things that it is literally approaches. They don't investigate all of them. So there's actually a really small number that they say, actually, I want to look into this more. So some of those initial approaches might be, can you tell me, have they completed the complaints process? Okay, we'll back off.
Just hang on to that for a moment because I'll come on to that. So an approach is a contact by either the council or the complainant.
Oh no, sorry. The approaches, 117, I think it was, approaches were from the Ombudsman to us. To make inquiries about a certain complaint that's got to them.
Right, I see. Okay, so of those approaches from them to the council, only 42 are investigated. That seems to me to be a very positive endorsement of how Dorset Council responds, or the thoroughness of services responses to complaints. Because if they've come back to and said in only 42 cases, that's quite suggests a robust processes in place before they decide, when they take a view about how they're going to respond, whether they're going to investigate or not. I just commend that, I think, in the context of how I understand it.
I think we're recognising that that's absolutely where we are. I think Dorset Council get it right most of the time.
That's good. I understand now, and overall, that's pretty much of an endorsement from I can see. And I mean, the question of whether 117 is a big number or a small number, I'll leave to for your comment, really.
It's a small number, it's a very small number. Bear in mind we have a single staging process for our non-statutory complaints, so it's without a safety net. So we're confident that our responses are fit for purpose and robust, and the investigations is watertight. So it's a really glowing report. So there is an issue around SEN provision.
Yeah.
We can get that right. Dorset Council really proud of this.
But at least you know where the bulk of what is outstanding and is subject to investigation is, and that's helpful in terms of most other things being okay.
Can I just
Thank you.
pause you both there? People online, can you hear clearly what's being said in the room? Because it feels it might be a bit quiet.
Just about.
It's not entirely clear now.
Officers are less clear than members.
Okay, so can I ask everybody in the room, when you speak, can you speak up a little bit? Because I'm struggling to hear and I'm in the room.
Oh, right.
Old. Thank you very much. My next speaker is Claudia. Did you want to speak anyway, Robin?
Could I? Yes, at some point. It's a question.
Yeah, I'll come back to you after Claudia.
Councillor Claudia Wyken-Rodwell. I just wanted to say that although I understand that complaints are intrinsically seen as a negative thing, I think it is, and I've noticed an improvement as well in the way that people are able to make the complaints. People from all walks of life are able to use the process easily in which to do so, and that in turn means them working together with the council, and anything that involves communication with outside bodies is a positive thing as far as I'm concerned. So I don't think it necessarily lead to negativity, especially if the problem is dealt with professionally. I think it reflects well on us.
Thank you. I really agree. As I say, some of the blobs on your report are red. I question whether they're really red. Does it matter that people are contacting us? I think it's a learning opportunity and a chance for us to make sure that the service we provide is reasonable and fit for purpose. We welcome the challenge. So thank you. I think you're right.
Robin.
Yes. Two elements really. One on page 50.
Can you introduce yourself?
Oh, sorry, I beg your pardon. It's Robin Legg, and I'm the councillor for Sherborne Rural. On page 54, beginning on page 54, you've got a list of those cases which have gone to the Ombudsman, have been findings of fault. And in the first column, you've got the identified cost. And in particular, you've got the one where the person has withdrawn on the basis that they're now taking legal action against the council, where it says £31,200 plus rolling costs. Is that likely to be the minimum cost to us if this legal action is followed through successfully? In other words, they've been offered that amount and they've decided that that's not enough.
That particular case, Councillor, is a good point, well raised. In terms of the complaint, the Ombudsman has made a decision and the complainant hasn't engaged with the Ombudsman's decision on it. What action they take, I'd be a little bit loath to speculate on, and there was the outcome of legal action I'd be a little bit loath to speculate on. In terms of the complaints process, it's finished, so it's really in the hands of that particular individual how they want to proceed.
Yes, what I was trying to get to the bottom of really is that £31,200 plus costs something which is a cost that we're almost guaranteed to incur, or is it something which might disappear if they're unsuccessful in their legal action?
It's the same question phrased differently, isn't it, really? I think the outcome's unknown until the outcome of any legal action is known. I think if we're unable to engage with that particular person and put the child back into a place of education, there is a potential that could be an extended period of not being in education. So if it goes back to the Ombudsman, there is a possibility that the Ombudsman may find they might want to look at it again if they make another about the subsequent period that they're still out of education. But in terms of any legal action outcome, no, I don't think I can answer it.
Okay. The more general question, and that is, and you've made the case, I think, quite well, that you can't always judge how poorly we might be doing by virtue of the number of complaints that are received, because they in some cases are often able to identify areas where we can make improvement and can be resolved without actually them landing on the desk of the Ombudsman. How do we compare, and I couldn't find any comparisons in the report, how do we compare with other local authorities where of a similar type to Dorset? Is there some sort of national league table where we sit in the middle of it or at the top of it, or in terms of the way in which we handle complaints and are successful in dealing with them?
That's a really good question. I can answer it. disappointingly, we're bang on average. The amount that they uphold in terms of the ones that they gets to them, they look at, bearing in mind it's a really, really small number that they actually investigate and uphold. The amount in terms of percentage that they uphold is bang on the national average. But in terms of the numbers that get there, ours is really, really low. But as a percentage, it's average.
So do you think there are any lessons we could learn from other local authorities that might be better coping with complainants?
I work quite closely with the Southern Group. A lot of local authorities are trying to get their complaints process and team that sits under the monitoring officer to the same point that ours is. We're about 5 years ahead in terms of an ideal complaints function. So in terms of numbers, I don't think there's lessons to be learned. I think the Ombudsman's percentages are very interesting, but you're comparing apples with pears a little bit if they're only upholding a small number in terms of actual complaints. If you say, come back to, I think they only upheld 5 place complaints. Place dominate our complaints. We get far more about place than anything. And the fact that they only uphold 5% of it, 5 cases rather, is incredible. So the SEN issue, I can tell you, is national. My colleagues, people are all saying the same thing. People want provision. There's just not the provision available. That leads to complaints. Doesn't make it right, but it does make it challenging. But no, the short answer to your question is, yeah, we're really aware of how we're doing alongside other councils, and actually really proud of what Dorset Council are doing and the way in which we're doing it.
Thank you very much.
Okay. I've got a couple of questions. When I was reading through all the examples of the various complaints that are in the paper, the one thing that struck me time and time again was poor communication in the early stages. So really, it's about management and adherence to the statutory guidelines and training. You know, it's the basic stuff. It's the bricks and mortar of how we operate. And I'm seeking assurance that this time next year, when we next look at the annual complaints, that basic stuff has been sorted, that we are communicating with families, even if it's bad news. We let them know what's going on, because we all know from our own experience, living in limbo is probably the worst place to be. So we need to keep parents and families on board with how we go.
No, thank you. I completely agree, actually. If it's got to me, it's already an opportunity missed, because people have resorted to the complaints process through frustration or not feeling that they're being listened to anymore. So I would love it if less stuff got to me and there was a little bit more proactivity about, well, we've got an issue here, we're going to communicate it to the people it may be affecting. This goes across the directorates. We'll ask you to bear with us. We'll be in communication. This is the plan. This is going to be the solution, and this is when it's going to happen. If all that stuff happens as business as usual, then that's where I think we need to be. But we're not quite there yet, I don't think, around children's services in particular.
Brian, I'm aware that you're waiting to speak, but can I just bring Amanda into the conversation? Is there anything you want to add at the moment?
No. Hi, Tony. Thank you. Just to say, we work obviously in partnership with Tony and colleagues, and really great for their support. But Tony's point just there is absolutely right. The point, and your point, Councillor Coombs, about that early, even if it's bad news, is absolutely how we're training and inducting our teams, particularly in SEND. So keeping people close, as you say, is absolutely the right thing to do, and describing honestly the difficulties or the challenges, and keeping their child close to us and in mind is absolutely the way we should do. So that's exactly how we train our staff. That's exactly what we're doing. And I think Tony would agree that we have seen an improvement in that communication issue, a big improvement, because it was a big trend in our complaints. So that action, we've started to see a decrease in complaints about communication the emphasis is really on the lack of educational provision, which is, we're also working on that as well, as we know. So.
Thank you. Okay, Brian, good morning.
Yes, good morning. I'm Councillor Ryan Hope. I'm the Cabinet Holder for Customer Culture and Community Engagement. And I just wanted to say, Councillor Coombs, I think you pick up on a very good point. The more that we can communicate with people very early on in this process can hopefully reduce the number of complaints, formal complaints that we receive, because obviously if we're communicating with them, resolving their issues front end, it won't come to that formal complaint process. And obviously this is something we're looking at within the transformation programme on the way that we work, especially within the customer service team, to see how we can communicate better front end to reduce some of the complaints. So that point is very much taken on board and is in our mindset at the moment as we look at that piece of work.
Fantastic. We'll look forward to improved results in next year's report. I'm going to bring in Councillor Beer because he's going to attend the meeting. Do you want to come to the table?
May I? Thank you. Thank you, Chairman. I'm only concerned. A lot of what we do is it depends on people being IT savvy. And in our rural area, there's a lot of elderly people. They're not comfortable with making comments or complaints to the authority online. And I would imagine we miss out. There's a lot of people who are concerned about things might have happened or how they're treated, but they can't deal with it online, and so they just go away. Or do we have a facility to accommodate those people with those concerns who don't naturally pick up their iPad and speak to you because when they're worried about how they've been affected by services? If I may, Chairman.
Really, really good question. Thank you. You don't know what you don't know, I'd say, to start with. So unless people do reach out to us, it's difficult to gauge how many use various different media to get to us. Certainly the online form dominate people's approaches, but we do take calls. The statutory process for children and adults require us to facilitate that. So people don't often do it because I think the sort of complaints we get for social care tend to be quite complex and evidence-based, and it's unusual for people to call us on that basis, but the customer service that Dorset Council provide, along with the complaints team, if we are unable to answer the call will go to the customer service team. The customer service team will fill in the complaint form on their behalf. We'll do it if we're able to take the call. So the short answer, yes, but very, very, very small number of people actually contact us by phone. And are we missing an opportunity to gauge how many people aren't complaining at all because they feel that they can't? It's a really good question.
I think Julie wants to come in.
If I may come in, I think there are three ways where we do capture some of that concern. The first is through the use of MPs, and the second is the use of councillors. We find a significant part of our older population use their elected members to raise issues of concern and to seek resolution. And the other element is our local offices and our local teams. So there's a vast amount of work that's done through the relationships that people have in the services, and our frontline managers do a lot of that early relationship management and problem solving. One of the things we found very difficult to capture is that first stage complaint, but that stops it coming formally into the council. So I think it's an area we need to continue to focus and work on, but I do think that there are routes that people do use if they can't use the electronic system.
Thank you, Chairman. It's not just the elderly and infirm, of course, it's those people I meet on a regular basis with mental health issues or whatever, and they don't know where to turn. You're quite right, they do come to local members. If you're happy with local members to pick that up,
absolutely.
That's brilliant. Yeah. Thank you.
I've got Chris and I'll come to you. Yep, Chris.
Yeah, can I just briefly go back? It's a comment, more than a question, I think. Can I, Councillor Chris Clippax, Minster Ward, sorry. Just briefly come back to this question about staff addressing the fact that somebody's complaining. I think there's an issue of confidence there. I'm obviously reassured to know that training is in place for staff to actually have a discussion about, even if it doesn't resolve a concern or complaint. And I think if more staff do this, the better they feel able to do it, because nobody wants to be the bearer of bad news, and potentially there is bad news behind all this. But the fact I'm very encouraged to think that staff are being systematically trained, because that will give them confidence to have that early communication, which they probably won't resolve, given what you said about the resources issues, won't resolve the complaint, but it does make everybody feel more comfortable in talking about it, and that's, I think, what matters at this stage. So just a comment. Thank you, Chair.
Good. Yeah, I would just add to what you were saying about councillors. I feel it's very much part of my role to be part of the complaints process, and I'm sure everyone else does too. And I think we can either be part of the problem or the solution. So, we have to take accountability for any complaints that are made as well, because if we ignore a resident or don't get back to them in a timely manner, or don't seek to understand what they want to say, then we're affecting this process as well. So I think we just have to remember that it's our responsibility at all times.
Without trying to sound overly charming, I'm really well aware of what a tremendous filtering service you provide to me and my team. So I know a lot of people do reach out to their MP, and I know that sometimes just feeling that they've been listened to, you can make a service happen without it going through a formal process. So sometimes common sense can actually just prevail without the need for undue process. So thank you for everybody that's had a hand in the solution.
I'll come to you in a sec, Carl. I think the important thing out of that is where local members are involved, that if there are gaps that we identify in dealing with those issues, that they are taken on board as a new part of service development to ensure that that gap is closed and it doesn't happen again in that way. Does that make sense?
It does, and I think there's a conversation to be had about really good learning that come through MPs' work and representations on behalf of people, and is the complaints function seeing enough of that? And I know I'm certainly working with Julia in particular on that at the moment. The lessons learned, just because it's come to us in a different angle, it's still really good stuff, and it's still stuff we want to share across the localities, so lessons don't have to be learned again somewhere else. So I'll be missing something of that. I think we may well be. So that's something.
May I just add one thing, Joe, and forgive me if I'm overstepping my remit in this space, but looking at the demographic data in the complaints profile, I do think there's further work we need to do about our hard to reach communities, because the demographic data would indicate some of our communities appear to be either abstaining from identifying themselves or not making complaints. And I think then your point about confidence works both ways. What confidence do our public have that we will address their issues and understand them? And so I think as officers, that's an area that we need to really focus on, is why is it we don't have good quality representation in the complaints field from people who are in the communities that we know we don't demographically represent in our Dorset population. So.
Yeah, thank you. Councillor Corwood, Gillingham Ward. This question is 17% of the responses that exceeded the 20-day timescale compared to last year improvement, which was good. Was that conscious effort, or is that just a variance of data? And then going forward, obviously, so that should be improved on again. So what plans are there to improve that again for next year?
That's a really good question. My feeling is that it's proportionate to the complaint volume that went through the process. So we had fewer complaints in compared to the previous year. So I think managers probably had a little bit more time to meet the timescales. It's a difficult figure to capture as a whole, because a lot of complaints come in through non-statutory processes like place and corporate stuff. And then you get the children's and the adults, which have got different statutory processes. So you're trying to capture a failure to meet timescale, and the risk associated with it is a little bit different. And I think if it's something from place that's quite low level and we've responded late, the Ombudsman probably won't take a view on it. But if we've missed the stage 1 statutory deadline, they probably will take a view on it. So I think for the timescales, you probably want to focus on the individual directorate's blob sheet. So I shouldn't call it a blob sheet, but that's how I see it. And the risks associated with that, I think, are better captured when you see it within its own directorate and which policy it's being considered under. So it's a really good point. My feeling is where the risk is the greatest, the pressures on the people that are actually managing and responding to those complaints is probably the greatest as well. So for them to find the time to invest to do a robust investigation, fit for purpose response, sometimes they're finding it hard to do within the timescales. I would add as a footnote, if we are going to miss the deadline, we're really clear about that and upfront with people. Just the point where we're sort of asking people to agree to the fact that we'd rather get it right and take a little bit more time than do something just to meet the deadline, because the Ombudsman will take a much dimmer view of a poor investigation and response, and then we'll do the timescale. But certainly a good point. It's not perfect, is it? We're aspiring to perfection. We have to acknowledge that it is an improvement.
I understand that a statutory deadline is a statutory deadline. However, I also understand that there are reasons why sometimes they are not met. And for me, an almost a secondary important parameter is how far beyond that deadline do we meet it? So is it dragging on for another 6 months, or are we managing it within a week or a few days? Because to me, that's much less of a problem, although it's an official, you've missed it. It still means that we're dealing with it. It's when it drags on beyond that I would have a real cause for concern.
And I think in the Ombudsman's eyes, if you've missed it, you missed it.
Absolutely.
And if it's partially upheld, it's totally upheld. I think the Ombudsman look at it that clearly. So we are aspiring to improve that every year. So certainly, the directorates understand there are just occasions where it can be challenging and quite, particularly in the social care world, it can be really difficult to unpick many years of concern and actually get down to the points that you really want to investigate and address and then demonstrate organisational learning from it. Sometimes you can't always do that in that window.
Thank you. Yeah, Councillor Laura Beddoe, West Purbeck. I love your point. Following on from Claudia's point, I love your remark about councillors being a filter. I'm going to put complaints filter on my CV because it's true. But I just wanted to sort of comment really about all of those, what Claudia said, comments filter, striving for perfection. We're never going to get to perfection because certainly from a councillor's perspective, we can go to members' PAs, we can go to councillor inquiry inbox. Now, if we all religiously used councillor inquiry inbox or whatever it is, the dedicated raising stuff inbox, you could track all our complaints, informal complaints. But what a huge amount of work that would be. And would we see any benefit to doing that? Because I know that if somebody makes a complaint to me, one of my residents, that their bins have been missed 3 times, I should pick up the phone to Tim at the Wareham Depot and he goes, oh, okay, no problem, and it's sorted. Now, that's not a formal complaint, but it is something that has been resolved. And similarly, there have been issues with adult social care, which I know that I've sort of fielded from a concerned resident, which I've been able to direct them to the right person, often quite senior, to resolve that. So I've almost bypassed the complaint system, and we are a filter in that way. Now, I suppose my comment it really is, does that mean that the system's working, even though we don't have data for it?
I think again, I go back to Julia's point, we're working and focusing a little bit more on the MP website for social care, because I think we are missing stuff. I think you are potentially, we are collectively bypassing a statutory process. So I would encourage MPs to feel quite comfortable in saying, sounds to me like you might want to make a formal complaint about this. Here's the link, or here's the guy's phone number. So there's a time and a place for that. And even your missed bin, if it's been missed 3 times, why? Is there something systemically wrong? it's still something which has gone wrong. And if it's just once, okay, let's resolve it, and common sense needs to prevail. But if something's systemically wrong, I think we want to look at it.
And I think that's a really good point, because, as Julia said, raising it through the MPs meeting, because I used to work for an MP as a caseworker, we've all got a massive hero complex. We want to be the one that solves it. So I would have found it in that role quite difficult to say to my resident, actually, I think this is bigger than me. I think you might want to raise a formal complaint, because I want to be the one that goes back and says, right, I've got you in touch with Officer Miggins at Dorset Council, and we've been able to resolve it. So I think that's I just wanted to draw that out a bit, because I think that's a really important thing that we're perhaps missing.
And I think it's an agreement with the person that's approached you in the first place.
Yeah.
You know, it can be a choice, can't it? It might be, do you realise that you can make a formal complaint and there's a statutory process for this? I'm happy to help you.
Yeah.
I can take it forward and try and resolve it, but you might want this option instead. So
absolutely. Thank you, Chair.
Okay, I've got one concern from the details, and that was something I really did not want to read in this report, and the reference to black bin bags for children in care. We outlawed that 10 years ago. Why is it back?
I forgot to introduce myself last time, Councillor Coombs. So Amanda Davis, Corporate Director of Education and Learning. It isn't, that's a real anomaly, it isn't back. And actually, through our youth voice work, we have actually introduced bags. So we have free bags now for any child in care. So that was a complete anomaly, just to reassure you.
It's referred to twice in this report, and that's 2 times too many.
Agreed.
Don't ever want to see it again.
No, we agree with you.
More questions? Okay, thank you very much for your input on all of that. We move now to performance scrutiny.
Good morning, committee. Hello. Joining you online today. So David Bonner, Service Manager for BI and Performance. Bear with me a moment while I just share my screen. Okay, hopefully you can all see that. So the committee have had an informal session already to run through the intricacies of the dashboard. There's a lot of information in there to identify any potential areas of concern or items that they'd like to raise in today's meeting. You can see on the screen that we look at 77 indicators. They're currently divided across the council plan. Obviously, as our new council plan evolves, so too will the dashboards. But this is the current cut, and it's showing that we currently have 3 red items flagged under creating stronger, healthy communities, and 1 red item flagged under creating sustainable development and housing. So I'll just filter through to those ones. And these were so there are 4 of those, 3 on the screen, and I'll flick to the 4th one in a moment. These are the areas that the committee just wanted to raise today as areas for potential consideration at a future meeting or for some comment. So the first of those is around our level of outstanding assessments against the Care Act in adults and housing, which has plateaued slightly as we've gone through recent months. Just hover over that. You can see the graph. Dark blue bar chart is last year's figures, and the light blue bar chart is this year's figures. As you can see, we're sort of pretty steady at the moment. There is no target measure for this, but the commentary there, I think, is reflective of the attention that's being given to this and the prioritisation around trying to solve this issue. But I will pause there and hand back to the committee.
Julia.
I was going to say this is an area we're working extremely tightly on at the moment. It is not good for people to be waiting for an assessment of their needs. So we've got a specific programme of work. I am less surprised that our performance plateaued during August. It is a time when our staffing resources are stretched and our performance in terms of reviews and all parts of our work dips in August. I think there's a challenge to us as a service about how we ensure capacity more evenly spread across the calendar months. I'd like to assure you that the performance has improved. Since then, we are now standing at 1,024 overdue assessments, which is a significant reduction again since the figures you've got now, which is August performance.
Chris.
Thank you. Councillor Chris Kippax, Minster Ward. I'm able to neatly tie this in with a question I could have asked of Sian, but didn't actually, about the number of increased number of safeguarding referrals that were indicated in that annual report. Is this a feature as well in terms of the overall number of outstanding referrals currently?
So actually, I think David Bonner might go on to highlight the safeguarding, exactly the point you're making. The number of concerns we have is significantly up on last year's performance, and we're averaging about 650 concerns a month at the moment, which is about 200 more than we had this time last year. Now, the majority of those are from residential nursing placements or providers, and we're doing lots of work to understand whether those are the right ones. It's not good to have any form of waiting list for safeguarding. Those are the people at highest risk. And I need you to understand that those aren't people where we're waiting to understand what the risks are. Those are cases where we're waiting to allocate resources to investigate the risks. So all of the concerns that come in are triaged. And again, we've done significant work since this performance report, and our current waiting list for allocation of work is 74. So again, it's gone down significantly from the data in the report. But it's an area we've got to continue to work on, and we're testing currently new ways of allocating our safeguarding work so that we reduce this even further.
There's a bit of a curate's egg there, isn't it? Risk and so on. Yeah, yes. But yeah, I get it. Thank you.
I would say that having been a care home manager until fairly recently, that care homes generally are under a lot of pressure to report every tiny thing to safeguarding, whether or not it really is a safeguarding or not, under pressure from the CQC, that is, or from other inspectors of their service. So I would imagine the majority of the things that are coming to you are probably not something you would even look at in any great depth. But I think, yeah, it's a reflection of the pressure on care homes that you're receiving so many of these.
And I think you're absolutely right. Registered providers have a difficult line to walk because they are regulated by CQC, and the expectations of CQC is that they will report issues of concern. If you look at in Dorset, and I think it was covered in the safeguarding report, the number of safeguarding concerns that then convert into statutory inquiries indicate that a lot of the concerns that are raised fall outside of that specific measure. So we will be doing more work with providers to help understand that line, but then also we need to do that work with CQC around what's reasonable.
That drives these.
No, absolutely, it's not easy.
But I also think it's about the raised awareness, I think, generally across the country these days about the importance of safeguarding, which is a good thing that people are aware and thinking about it. But obviously it does impact on your workload.
We have a conference on the 20th of this month to raise the awareness of adult safeguarding. So it's something we strive at, and I think there may have been a question at one point about the number. We do a number of community events as well to try and raise that problem.
Carl.
Yes, Councillor Colwood, Gillingham Ward. This is actually back from the July narrative here. There's a mention of discussions started around what to constitute as waiting for assessment due to discrepancies between ours and other local authorities' definitions. Can you just elaborate on those discussions over? What were the conclusions of that? What's the implications of that?
Absolutely. So in the adult social care world, there is recently introduced something called client level data, which is the government's ambition to have a standardised way of capturing performance. The the challenge to that is local authorities do not capture information in the same way, because we have the ability to commission our own customer client databases, and each one of those is set up in a very different way. So when you look at different local authorities reporting, where you capture the point at which you decide whether an assessment is waiting or not varies from local authority to local authority. So some local authorities would say that at the first point of contact, so when someone comes through, if you have made a decision that it needs to be passed through for a formal assessment, you've already made an assessment judgment. So some local authorities would report at that point that that is no longer waiting for an assessment of need, because under the Care Act, they've completed what would be defined as an initial assessment process. In Dorset, we don't do that. We don't currently count those as our formal assessment lists. So the figures you have before us are concerns where we've done all of the vetting, we've determined there's nothing else we can do other than undertake a full Care Act assessment of need. We risk assess that to prioritise those people. So those are people who are waiting either for a complex occupational therapist assessment or a full Care Act assessment, but they will have gone through a number of triage places. So that makes our data unique to us. And when we capture it on our database, which makes it really tricky to compare it, for example, with even BCP or other local authorities. And it's something that the South West ADA, so the adult directors of social services, are looking at. Can we get a much more uniform reporting process to make that better?
Thank you.
Questions? Okay.
Okay. All right. Thank you. So I have moved. Hopefully, you've noticed I've moved the screen on to the next one, which is indeed the adult safeguarding activity concern. So, Julia, just as you were mentioning, it does say in the commentary that the highest number of referrals, 40%, is coming through from residential and nursing staff. So, assuming that hasn't changed significantly since August, is there anything else, Julia, you'd like to say on referral on adult safeguarding, or shall I move on to the next one?
I'm happy unless any members have any other questions. Move on.
Yeah, move on. Right. Okay. So very unhelpfully, Teams has put my bar exactly over the. There we are. Right. So the next one is around the proportion of older people aged 65 plus who are still at home 91 days after hospital discharge. So this has been flagged as a red metric and worsening. I'll just hover over that one again. Dark blue is last year, light blue is this year. So you can see that we are slightly higher at this point than we were last year at this point. We don't have a target for this measure. Pause and pass that back to members for questions or comment.
Julie, do you want to expand on that? Shall I give an explanation in the first instance? So this is a historical measure that used to be reported up to government annually, looking particularly at the effectiveness of reablement services. So the idea was that if people had a short-term intervention following a hospital discharge, the ambition was that you would then be resulting in a longer period at home before they had another hospital admission. I think that the notes indicate that we recognise the need to understand why people are, why our figures are not where we want them to be in terms of percentage of older people. And currently the information I've got from the deep dive we're undertaking is that a lot of the readmissions are actually linked to clinical issues. The three main clinical areas in Dorset are UTI, so urinary tract infections, falls and sepsis. Now that doesn't mean that our reablement services are as effective as they can be, but the particular data points that you've got in front of them, those are the three primary reasons for readmissions to hospital for the cohort of people. We are, however, as part of the partnership, so part of our health and social care system through what's known as our urgent emergency care work, which I know has been socialised with members, we're looking at how to improve our reablement offer so that we are minimising the chances of people being readmitted because they're not supported to be independent in the way that we would want them to be.
I think that's a really important point. And I'm just wondering whether we ought to have a look at when you've got some more data on it and to see how effectively that's working and whether there's anything that we could do perhaps to help. I don't know what sort of time period you would consider appropriate, whether it's sort of 6 months or a year or how it would play out.
The urgent emergency care work is system work, so it will take time. It's just at the point of mobilisation. So I would think that a year would probably be the better judge to get more reliable data on that.
Jane, you've got a question?
Yes, thank you, Chairman. Councillor Jane Somper, Beacon Ward. Julia, just breaking this down a little bit. Are these numbers, do they relate to people who are going back into hospital rather than people who may be having to move into a care home?
So no, you're right, Jane. It's a combination of the two. It's people who are no longer in their own homes.
And presumably the issues are more complex for those people having to go into a care home. A decision has to be made by them, their families, that's the best place for them at that time.
Yes, I mean, the reason why people enter a care home setting is, as you say, very complex. We have a very high success rate in Dorset in actually maintaining people in their own homes. And the average age for people entering a care home in Dorset is the late 80s compared to people who fund their own care where they enter much earlier. So I don't think we should see someone ending in a residential placement as a figure on its own necessarily as failure, because that individual could have been supported for a long period of time to remain in their own setting. But if Scrutiny would like, we can include further work in the deep dive to examine all of those reasons and the routes where people end up. Happy to do that if that's what the committee would find valuable.
You're welcome to come back.
Chairman? Yeah, sorry. Thank you, Chairman. Julia, that's really helpful because I think these numbers, therefore, the breakdown isn't in there. And as you say, it isn't necessarily a negative for individuals to go into a care home. So understanding when you do that deep dive of the breakdown, those numbers may be different in terms of the understanding, what the issue is around people having to go back into hospital versus going into a care home. So I think these numbers are, although important and helpful to a degree, they don't give the whole picture.
She's nodding.
Sorry, nodding away and writing notes.
Okay, are there any more questions from the committee? No. Move on.
No. Okay, thank you very much. So the final red one indicated by the committee was around single households and bed and breakfast. So the net number of single households and bed and breakfast at the end of the month, which if I just hover over that one, it's a metric we've been tracking since the beginning of the year, and we can see that it is improving, but it is still being flagged as red. I know we have Andrew in the room. So Andrew, I don't know if you'd like to comment on that one.
If invited, yes, thank you. Many people in this room have heard me say this at the other sessions we've discussed. I mean, this is one part of a fairly complex sequence of things that we do around homelessness. So around preventing homelessness has been our key driver around the more you prevent coming in needing to have bed and breakfast or temporary accommodation, the better for those individuals, whether it's single or families. So just the context of this I want to go into. Specifically this performance metric. I'm happy that it's red because one person in bed and breakfast is too many. But the context in certainly national terms is our performance in this area is strong. Reducing bed and breakfast usage is rare across the country, and many of you will have seen press around district councils, but also unitary councils in London are showing rises, significant rises in bed and breakfast and temporary accommodation use. And our overall, we've reduced reliance on temporary accommodation across the year by 25%, particularly in families, which is the context for this metric. Shows a relatively static position with single people in bed and breakfast, because we've focused more acutely on getting families out of bed and breakfast, which is a bit more difficult, having children brought up in B&Bs, and that the reduction there is going from 50 families to 20 over that period. So I think I just wanted to get across the performance around bed and breakfast use in the round is showing very strong performance, whereas with single people this is more static. The other thing to stress to this committee as well, it's not the same number of people. It's not people sitting there for a year. That's why I opened up with saying this is a complex flow, if you like, of things. So we do rely on emergency accommodation, bed and breakfast type accommodation. If somebody, say, homeless on a Friday afternoon comes to us in crisis, we have to put them somewhere, to house them somewhere, and that tends to be there will always be the need for that kind of accommodation. Our performance management across our team is to move people on as quickly as possible into more appropriate, more settled accommodation. Just to stress that, whilst that we're in this number of 57 single people in bed and breakfast, that moves on quite rapidly.
So a follow-up question on that.
Yeah.
How long are these individuals staying in B&B?
Again, it varies, sometimes depending on the complexity of need for that person. And it might be in the body of some of the detailed performance reports. We do a lot of work with organisations like Shelter and the Lantern in Weymouth around supporting people with quite complex needs into settled accommodation. And sometimes that takes more time, sometimes it's more complicated, sometimes it's more difficult finding the appropriate house or flat to move into. I'm not evading the question. It could be days, but it could be several weeks of working with that person to get them properly supported into a settled accommodation that works. Because there is certainly within the housing world, there's a phrase that's used about the revolving door of being given a tenancy and then failing for not being ready or not having the appropriate support. So the answer on that one is we try to move people on as quickly as possible, and for that to be days in most situations, but sometimes it needs time to do well. What we do, because we do have at the moment there's around 80 bed and breakfast rooms being used, but in total we've got 270 temporary accommodation units, which are more self-contained, more appropriate homes. So we would move where we can people from that kind of homeless on a Friday afternoon stage into self-contained temporary accommodation. Also two-stage route towards having a tenancy with a housing association or whatever. So we do try to do that first stage move on where bed and breakfast really isn't appropriate. I don't want to go on forever about it, but I think there's another thing I'm pleased about in the time that I've been here is our more intelligent management of bed and breakfast use in places like Weymouth Seafront, sort of the area, the bed and breakfast establishments around the Lennox Street area of Weymouth. We've spread the use more effectively, so there's less because it was evident that having too many people with complex needs in one hotel or B&B caused difficulties for neighbours, but also for those individuals in the scheme. So I think we try to we manage it on a number of fronts. I'll stop. I'm sorry, can I just say a simple point? Because I'm more than happy this stays as a red, but I do think also that's why I'm emphasising the strong performance, because you'll hear this at there's a question to Cabinet next week as well. Our direction of travel for the council is to get out of bed and breakfast altogether by the end of 2025, calendar year 2025. So that's a serious plan, is to get this down to zero. So I think it's right to have this as a red, but it's a bold and ambitious plan that we've got in place, but that's what we're intending to do.
So we'll have an update in January 26th then.
Yes. Well, there's plenty of updates, but it's on track. Pleased with the performance, but one person B&B is too many.
Absolutely. Any questions on this bit? Move on then.
So, well, that concludes all of the 4 items flagged for discussion today, Chair, in our pre-meet, unless anything has subsequently come up that you'd like me to show you on the dashboard.
Not getting any
no nods, right? In which case,
thank you all
very much.
And I believe this might be the last time we see you at committee.
Yes. So I just say to the committee, thank you very much for your support over the years, and it's been a pleasure working with you.
And I wanted the same on behalf of everyone here, both officers and members, because we need people like you.
That's much appreciated. Thank you very much.
All the best.
Thank you.
Okay. Moving on then, the next agenda item is the cost of living challenge update, and Laura Cornett's going to take us through this.
I think Councillor Hope will do an introduction first. I think Councillor Hope will introduce the item first.
Ryan, I understand, Laura, you're going to be introducing this.
That's fine. I can give a brief introduction and hand over to Laura to go into some more of the details. So once again, I'm Ryan Hope. I'm the Cabinet Member for Customer Culture and Community Engagement. And I'm here today obviously presenting this paper to Scrutiny, and Scrutiny that I welcome to make sure that we are on this clear direction of supporting our residents in Dorset, especially those most vulnerable. The paper you've got before you highlights some key achievements, I think, that we've already looked to undertake. But obviously this project's not without some risks, and those risks in some instances have been out of our control. They've been the political direction of the new government, waiting for responses, waiting for budgets, which is why you'll note that not the full £2 million has been allocated or all projects yet started. So some of the key achievements I just wanted to highlight really here is the investment, £2 million. That's a commitment from Dorset. Project selection, 17 good projects, of which 14 are approved and working forward, with the other 3 just waiting on overview of relevant scrutinies or overview committees. The government alignment, obviously I mentioned that some of the projects were delayed whilst waiting on government announcements, but really we like to think that this project is looking to fill in the gaps where government is no longer supporting, and no duplication of workload. And of course, as I've mentioned, the ISA scrutiny, the accountability, I think that's key to make sure that the £2 million is spent in the right direction, in the right location. Some of the risks that we are currently facing and challenges, I've already touched on the underspend of £500,000 to make sure that we're hitting on the right projects and we're not overstretching ourselves. Potential funding gaps, again, whilst government continues to make announcements and set their direction. Obviously that £500,000 will be used to try and fill some of those gaps where we feel we have the resources and that we can make a difference and the need is there. And again, we'd like to keep this fund rolling year on year, but that's a dependency on the future government policies. Much of the work we're looking at doing is preventative, and with that preventative, we'd like to try and reduce this year on year as we try and move people out of reliance on some of these projects and schemes. But we understand that there's going to be a continual challenge as funding is drying up in all locations. And the other risk currently for us is the unapproved projects. We obviously moved all 17 projects forward to the overview committee. 3 of those were needed more detail and a further overview. But of course, whilst we continue to lay those, we're not getting that support to some of the residents and some of our most vulnerable people. So really at the moment, that is a risk to the delivery of this programme and something we need to accelerate through council. Going to hand over to Laura now just to go through some of the more details in some of this project and then welcome any questions from committee.
Okay, thank you. I'll let Laura do her bit first and then we'll go into questions.
Thank you very much. Thank you. So for any new councillors, I'll just give a very, very quick background to how we've got to this point. So back in 2022, we created the Dorset Together cost of living programme in response to the rising cost of living and the direct financial impact it was having on some of our Dorset residents. In the last, as Councillor Hoper said, in the last financial year, we allocated a budget of £2 million from reserves to support a series of projects that addressed gaps in the national provision of support. If you want the details of those, that can be found in the background papers. And then the new cabinet agreed up to a further £2 million to continue support for this financial year, with a commitment that it would be built into budgets going forward. So as Councillor Hope has already said, in the Appendix 1, there is a full breakdown of all the projects that were recommended or put through the overview committee back in July. So, and then the request was from the overview committees that I come back at regular points in the year to be able to give an update on how we're progressing with those projects. So going on to item number 2 within the report. So the item 2 gives a full breakdown of where we're at with all the projects, including the spend to date. There's a couple of projects I just wanted to highlight in detail. So just move along to project number 3, which is Assistance Advice Cost of Living caseworkers. So at the bottom of the detail there, Assistance Advice have reported to us that their cost of living caseworkers have helped a total of 219 clients deal with 593 issues and achieved income gains. That's usually through benefits maximisation of just over £250,000. That is in addition to their usual work they do with us. So that's a direct impact of having those posts in position that supports our most vulnerable residents. Moving on to project number 4, the discretionary housing payment allowance. So I just wanted to draw your attention to this one because obviously there's a zero spend on that currently. So with the national government support on this for the discretionary housing payment allowance, the condition of that funding is that they have to spend that fund in total that they get from national government prior to accessing other funds. So like in the last financial year, we would not expect a drawdown on this until within the Q4. But it does mean that those teams are able to give slightly more generous positions and support because they do know they have got an additional up to £100,000 buffer on that. Project number 5, the Disabled Facilities Grants. So far this year, they've been able to offer 10 grants of an average, totaling at just over £40,000. That was the end of Q2, so that's the end of September. So that enables some of our disabled residents, either homeowners or in long-term rented accommodation, be able to have homes that are fit for purpose and does obviously support us in the longer term. Okay, project number 7, the emergency and affordable food security. Once again, currently there is a zero spend on this. And the main reason on this is because the purpose of this fund is to fill in gaps from national government funding. Obviously, recently the Labour government announced an extension to the Household Support Fund. So there is support going out to those emergency and affordable food projects. So usually for food banks, social supermarkets, but that will be funded from the government-funded Household Support Fund. But there will be a targeted fund, a grant fund open to them at the end of November this year. Moving along to project 8, sustainable and affordable food and security projects. So this is where we move more into the prevention and intervention agenda, whereas the emergency food is for those who obviously have no food on that day. So we've listed some projects that have been authorised by Councillor Hope and Aidan Dunn on what we should be on projects that are now existing. But I just wanted to draw the Cabinet's, the Committee's attention to the fact that under development, we're currently working with some groups hoping to restart some community lunch clubs, particularly for older people in the east and the north of the county, we found most of those closed down after the COVID period. And we do plan to have those funded projects up and running by the end of November to support the additional Christmas need. Project number 9, targeted means energy support. This won't be funded at the moment, once again, due to the extension of the household support programme. So very recently, so as I was writing the report, so the government were announcing their budget, and they did announce that the household support fund would be extended. It will be extended for the next financial year, so as well, so for 2025 and 26. However, the detail of this and the levels of funding will not be available for our officers until the new year. So we will keep this one very much on the agenda and pull on it should we need to. Moving along. The last one I wanted to draw your attention to in the funded projects was project number 11, which is support for older residents with benefit applications. So obviously since July, the Labour government did make the announcement to cut the winter fuel allowance for those unless you were on pension credit. So as a response to that, we have extended the amount of money to allow up to £75,000 available, and we've put a focus on organisations that are able to complete the applications for pension credit. Pension credit is a passport benefit, so if anybody is on pension credit, they are then entitled to get their winter fuel allowance, and we have until the 21st of December this year to be able to get that through. And we've as per the overview committee's recommendation, we've made this available in a much more locality-based way. Full details are available in section 3 of the project, which I'll jump to very quickly. Sorry. They've taken away my touch screen. Zoom moves a bit slower. So, and I think also it's very important to just raise with the committee that in addition to the support we're giving to voluntary sector organisations to help with the completion of those applications, which is quite often a barrier for some of our older residents actually making the application, we've also used some of our cost of living funding to deliver a full marketing campaign aimed at older residents and their families and even grandchildren, adult grandchildren, to encourage the conversation with their older person, to encourage them to apply for pension credit, or to see whether they're eligible, because they're a homeowner or they may have some savings, if they're entitled to just £1 a month of pension credit, that is the passport to enable them to be able to get the winter fuel allowance. And we knew at the start of this season that we had about 5,000 residents across Dorset who were entitled to it and not applying. So we're doing everything we can. And I know there was a question for council a few weeks ago about that.
Before you move on, Joan wants to come in with a question, but can I just quickly ask you, what's the uptake been so far?
Really, really good. Yeah, really.
Because you mentioned 5,000. So what sort of number have we seen?
We don't know exactly, because that goes directly to the Department of Work and Pensions, and they won't give us the data until the end of the financial year. But however, with these organisations working on the ground, and they are now just starting to go out, we will get that data back. So we will know in April. I'll be able to feed back to this committee about the impact we've been able to have locally. And of course, with media campaigns, it's a little bit more subjective. But we are noting, our comms team are noting the shares and reshares and things like that. So we'll be able to give you some of those statistics.
I'll pick it out. Okay. Oh, sorry.
I don't think Laura's finished, so I'll wait till Laura's in, because she's in full flow. If I can come in then. I just wanted to get my hand up quick.
Thank you, sorry. I have almost finished. Sorry, very quickly. So just also just for the committee, just to make you aware, that going back to 2.4 is that we did know this year would be a year of where we need to be able to flex some of our budgets, because obviously with the new national government coming in, And almost week by week, information does become clearer. But we will, as a team, continue to look for new gaps, new emerging trends identified within our data, and obviously with our sources on the ground within our councillors and with our voluntary sector organisations and frontline staff. And we will to continue to use this funding, as effectively as possible, to ensure that we are kind of supporting our residents that fall through those cracks of that kind of standard government support. And there will be a full monitoring and statistical impact report coming to you at the end of the financial year, which should be in, we'll do that in April, so together the full years. So really just of today, just going back to the recommendations, I'm just asking the committee today to review and comment on the progress that we've made so far. Note that the government has recently announced the extension of the Household Support Fund, and also note that so far we have awarded 1.5 million or thereabouts, or committed, and where possible, so we intend to try and maintain that balance of working with projects within that financial envelope, and then offer the £500,000 so that can be transferred into the next financial year, given the council's the current budget predicament. However, obviously, if any new emerging trends do come up, we would like to have that flexibility to continue to spend that if possible. Thank you. Sorry, that's quite long. Thank you. Jane.
Thank you very much. Thank you, Laura. So, Councillor Jane Somper, Beacon Ward. Laura, a really detailed report. Thank you very much for it. And very interesting to hear about your ability to be flexible with these numbers and with this budget, because of emerging trends that may surface for our most vulnerable residents, particularly as we enter in towards winter when it gets cold. So I feel comfortable that you'll be on top of that should needs emerge that you hadn't anticipated. I know that government has put in more, but whether or not it will be sufficient will be another thing coming forward. There's a couple of points, just specifics, if I may, Chairman. You talk. There's a targeted grant programme on the emergency and affordable food security that you spoke about that's going to open in November. So I don't know what that is, and it would be quite interesting to learn what that looks like, who that's aimed at, how people can get more information on that. Very pleased, obviously, to see the community lunch clubs under development, obviously, particularly in the north, because I am in the north, and I know that there was a big drop off on that. And as we know, this is a valuable resource for some of our older residents who can become particularly isolated. On number 10, the targeted programme, where you're doing you carried out a survey. I'm glad to see that you're going to be doing a targeted workshop on that, because those numbers are quite stark. And drilling down into that, I think being able to understand more about what's under those figures, I hope that you'll be able to report back on that. The applications, the community transport network. So you're sending applications to local town and parish representatives for comment around these. There's no mention in here of the ward member or ward members to comment, and we know members will be across some of these really important transport problems or lack of transport. These my rural patch, there isn't any. So, I would really like to be able to feed into that to comment, and I'm sure other members would as well. I'm going to stop there because I know other people will have questions, but just those, Laura, for you.
So starting with the targeted food security grants programme, so we work very closely with all of our food banks across the Dorset Council area, because almost all of them are individual and not run by national organisations, and also with our social supermarkets as well. And this is something we've done over the last, since the start of this, since back in 2022. So we send out an application form just to our key contacts there. They report on the numbers that they are supporting, and then we allocate the fund accordingly. So obviously those that have greater numbers receive slightly more funding than those that do lower numbers. Because also we have some really great food banks, for example, that support 20 families. So it's us making sure that those 20 families are still equally supported as those, for example, the Weymouth network that support nearly 3,000 people. So we value all of our food banks and social supermarkets, but I can either send out after this a full breakdown of the previous round for that, if that would be helpful for members. But if not, I can, at the next one, there will be a full breakdown, of course, there. Moving on to your community lunch clubs, obviously my plea for any councillors, obviously particularly in the north and the east of the county, if you know of a lunch club that has ceased, or you feel there is a need for one, obviously please come and talk to my team, and obviously we can try and work with the community there, and to develop a project to kickstart the funding. So we have recognised, for example, one of my officers, Emily, is doing some work over in Burwood at the moment, because there was a lunch club there that was stopped just after COVID. We're working with Age UK, Bournemouth Pool and East Dorset, who used to run that. And we're working with them to try and find a way to get, because transport is the issue with that one, to see whether we can restart the lunch club. They have the volunteers, they have the food, but it's just kind of working in that way to make that programme work. And if we can give them some kickstart funding by helping them get the older residents to the lunch club, then that's kind of ready to go. So that's a need particular in that area. And similar projects obviously in the north. So if obviously as our eyes and ears on the ground, we'd obviously welcome any information that our project officers can work on. And then Jane, your last point about the community transport network, absolutely. We're running that programme through our community transport team in the Place Directorate, but I will pass that on to ensure that ward members, as you are with our normal grant funds, are included as part of that decision-making process.
In response to that bit about the lunch clubs, I think all local members would like to be involved in knowing about what's happening in their wards when you're doing projects like that.
Absolutely.
I mean, we should know it already, but it would be nice to, just make sure there isn't a gap there.
Absolutely. Yeah. Thank you.
So on my speaker list, I've got Carl next.
Okay.
Sorry. What was it called? No, not me.
Okay. Well, I can ask a question anyway.
Go on then.
I mean, there's a lot of stuff you're working on here, and I think you've already hinted a bit on how you're kind of allocating things, but how are you just managing to make sure these projects are kind of distributed across the entire area, basically, instead of like focused in certain bits and things like that? How are you managing that overall?
So it's a bit of a combination. Luckily, I have got a team of experts who are very much, they know Dorset, they know where the needs are, they know where the pockets of deprivation are, and they know where there's some really great community organisations, and they know where there's not so many, obviously, because Dorset is a beautiful patchwork quilt of all different types of activity. So we do very much rely on officer and the voluntary sector's expertise in helping shape these projects. When we first put together this whole programme, and obviously this is a successor to a previous very, very similar programme, and many of the projects are actually the same or maybe have a slight tweak on. So it's all about experience and expertise. And I did notice that so the need was for the emerging food projects, so the sustainable food projects, because of the nature of Weymouth, naturally 2 or 3 projects came quite quickly through there. And then my team said, oh goodness, we need to have a look at the rural areas and things, but that takes a bit more resource for us to go out and find. So that's why the kind of quick wins happened in Weymouth very quickly, because the community groups on the ground were already asking for those, and we just didn't have a way of funding them. But we always try and make sure, we work for equality across Dorset Council area when it comes to grant funding. So that's why we've we've been working with some of those groups that we know on the ground, and we have got some great community networks, and we work with our officers in, for example, in public health as well, the health equality officers there as well, so they work with some of their communities. And we've got a great infrastructure organisations that we fund and some that we don't fund, but we have a really good network of vulnerable sector organisations that tell us quite often. And obviously councillors as well will always tell us when things have stopped or they want to start this, or have you got funding for this? So so my team work very, very closely with our communities.
Got quite a list now. Chris.
Thank you. Excuse me. Councillor Chris Kippax, Minster Ward. My two questions relate to item 2, Healthy Homes Dorset scheme. I'm assuming, but tell me, correct me if I'm wrong, that those are about installation projects. It doesn't actually say so, but fine. And so the current improvement works are underway, which have cost around 4,000 each, and £117,000 has been spent. But it's indicated that also £200,000 has been spent to date.
So
the remaining money that wasn't spent directly on the improvements, the installation.
Yeah. So that is we, by saying what we've spent, is we've transferred that budget line outside of our budget into the budget within in place, which is in economic development. So this Healthy Homes project is part of a wider scheme. So the last, I think it was back in early 2023, Dorset Council were awarded, I have to look back on my other reports, about £4 million to support, as they call it, HUG 2, which is the home upgrade HUG grant, home upgrade grants from national government, and that funding was purely to support houses that were off grid. So we identified that there would be people in homes either rented or owned that wouldn't be able to access that funding because they were already on the mains networks. So we then, in the last financial year, put in, I think it was just a bit more than £200,000 to support, so where Ridgewater Energy, they're our contractor that were contracted to deliver that piece of work. So we already had a contractor in place. So it meant that they were turning people away because people would phone them up and say, well, my house, so single glazing and so on and so on. But because they were already on grid, they weren't eligible for the homes upgrade grant. So then this kind of filled that gap. But it's only because there's a small amount of money compared to the home upgrade grant fund. But what it's allowed Ridgewater Energy to do is really go out and target some of our either deprived areas or and there's a big thing about park homes, because if you live in a park home, you weren't able to get a lot of the previous government's energy support in the last financial year. So we had lots of really vulnerable people living in park homes who were not able to access any of the energy support and things. So their oil and gas were really, really increasing. And so this is where that's the purpose of this fund, very much was to kind of support that. So that's why the this funding is purely for that kind of home. But to answer your question about why is it £200,000 and then Ridgewater Energy is £117,000. So we've moved that budget over to economic development, the full 200,000, and so far they have paid 117,000 out to Ridgewater Energy because they have to deliver before they can put the invoice in.
So Andrew wants to come in with some more.
Obviously, I'll be very brief to recognise we could talk England. The paper going to Cabinet on Tuesday, which will go a bit more broadly into the housing element of Healthy Homes Dorset as well, around what assistance is available for to help particularly private tenants, but also wider ownership, housing associations, etc. So that investment specific, one thing I wanted to add there, that specific cost of living driver is people not being able to afford to pay there's a broader, Laura said this, but there's a broader range of activity around it, including what the housing associations are doing with their own resources, just to answer this specific question about cost of living. Because a badly insulated home, an inefficient heating system, there's a number of drivers to drive up bills as well as ill health. So anyway, what I'm trying to say here, Cabinet paper, I recommend that to have a read of that as well, because there's elements in there which I think will support the it complements the cost of living funding that we're getting.
And just to confirm, it isn't just for insulation. So the Ridgewater Energy agents will go out and they will do an energy assessment. So if they're single glazed, and actually they could have double glazing if the boiler is 15 years old and they're not eligible for any other boiler upgrades. So it's anything that can support with an energy improvement that would enable that home to be, the resident to be healthier, warmer, and keep them independent in their home for as long as possible, which I think obviously has a positive impact. Because following Julia's confirmation earlier that obviously our older people are staying in our homes longer rather than going into care homes, which obviously has additional costs.
You want to come back,
Chris? Just briefly, I mean, so a proportion of that 200,000 is being spent on consultant, on advice, technical advice to home owners and
so our funding is purely for the actual upgrades. We've piggybacked off the back of a much larger contract that has the economic development have with Bridgewater Energy as part of the home upgrade grants. So that is funded. It's the HUG funding that is paying for the agents. All of ours is going on tangible items with direct support.
Good news. Thank you.
Laura,
thank you.
And then I'll come to you, Robin.
Thank you, Councillor Laura Beddoe, West Purbeck. Thank you for the amount of detail in this. I recognise a lot of it because I've been part of it previously. The bit that I just wanted to ask about is more a matter of clarification. So project number 6, the Lendology. Thank you for putting the link to the overview committee in, because that was really helpful background. What I just wanted to clarify was the updated policy was supported by overview, recommended for cabinet sign off, blah, 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 blah. I will give a further verbal update at the meeting. Do you mean at the cabinet meeting or this meeting?
Sorry,
right.
I missed that in my introduction.
No, that's fine. And if you are able to give a brief verbal update at this meeting,
yes, I can do that. Yeah.
What I just wanted to understand, where it says invest in an endology, is that investment in the CIC itself? Because when I look at the overview, I haven't got touchscreen either, I don't know why I'm doing that. When I look at the overview notes, it says that the capital for the loans through Lendology is provided by the council, but administered by Lendology CIC, Community Interest Company. So are we providing the capital for the loans, Lendology are administering the loans, and additionally, we're investing 50 grand into the CIC, or is that 50 grand the capital that we're lending out?
Yes, that 50,000 is the capital we're
Fine,
lending.
thank you.
So, but sorry,
because the word investment slightly confused me.
Yeah, okay,
so thank you. If you could just sort of explain.
Yeah, absolutely. So just very quickly then. So when this one went to overview back in July, a lot of councillors weren't familiar with what Lendology as an organisation was. So the decision was that a paper should go from the housing allocations service manager to kind of give a bit more information to all councillors about that, and then following that a decision could be made. So that happened as I was writing this paper. The minutes are not quite available yet, so Councillor Hope and Aidan Dunn have not had the opportunity to review everything, but they will do that in the next week or so in order to make a decision about this. But the way Lendology works... Oh, sorry.
Can I just maybe save you some... a second time, I'll plug the cabinet paper. There's more. Richard Conway is the person that Laura refers to, who's going to be there at cabinet on Tuesday. And the one quick thing that came up at overview, specifically looking at the private sector assistance point, was about doing more briefings on Lendology and a range of things. So that's coming. So we'll not just around this lens. We're trying to recognise it's complicated. We recognise that people need to understand how it all fits together. And can I just, while I've got the floor, the aspects of it's not quite sharp end of affordability, but certainly we're recognising that middle income or sort of low to middle income people are also struggling. So around how far we can stretch the sort of loan facilities to help. Yeah. Middle income people might not be top of our list, but they're still struggling. That's another thing we're working on. Slightly outside this remit, but it's a briefing on Lendology and the wider range of aspects is coming. Yeah. Sorry, Laura.
No, it's fine. So as a very, very, very quick potted history. When we first went into Lendology or signed up to Lendology, we put in, I think it was about £800,000, and that £800,000 is protected for only loans within the Dorset Council area. And then loans go out, and then also they pay a very small amount of interest, and then that gets done. Because they're a CIC, they're not there to make money because all the money goes back into the business. And where residents so some may struggle to pay back the loans, they're very quick to renegotiate and extend those out. So that's been invested, about 800,000 has been invested for, I think it's about 2012. So it's been going on for a very long period of time. We've reached the point now where we actually haven't got very much left more to invest because most of it out in loans. So I think they get back about 25 to 50,000 pounds a year to reinvest. When I was having a conversation with Richard Conway about what preventative measures we could have to support residents and that kind of squeezed middle of those residents that are working but on low incomes, to help. And he said, well, it is a little bit left, it's a little bit out there, but because if we were able to invest anything, minimum 50,000 but upwards to this, it would help those teams to be able to support residents that need loans. And it quite often works with the disability facilities grants. So if it's assessed that they need a certain amount, say up to say £50,000, and they're only eligible for £20,000, they could take out one of these Lendology loans to kind of pay the rest, if that makes sense. So it works together in a big jigsaw puzzle of preventative and longer term support for us.
Really helpful. Thank you. Robin, finally.
Thank you. Robin Legg, Sherborne Rural. Do you have a view as to which of those projects is the most cost effective? I mean, when you look at item 3, which is the support we're giving to citizens' advice, that appears to be extremely good value for money in that they're drawing down lots of other funds from national government. Do you have an opinion as to where the money is being best invested and best return for it?
I wouldn't. It's probably not my role to have a real opinion on this. So my role within this is to put together some proposals of broad support and identify different types of support that some of our residents need. Obviously, some of it's emergency, and without that support, they could end up homeless. They could maybe not have any food for their children for that night. So we've put in support for that. But obviously, with the cost of living, we want to move towards preventative. So then there's some projects that are more slow burning. So sometimes it's quite hard to compare them like for like. But I would genuinely believe that everything I've put forward, or my team have put forward for the overviews decision, obviously for assessment today by Scrutiny, every single one of these has a really quite impactful, or hopefully a positive impact on our residents who may not be eligible for government support. So the government support are very good at supporting those that fall within the benefit system, but we have identified through our data, we have a whole host of residents that fall just outside of that. So for example, you may have 2 working parents, but maybe on living wage, and they're in private rented accommodation, and everything's fine until the car breaks down or one of them loses their job. And then that's when they would really, really struggle and could potentially fall into crisis, end up losing their home, all different things. The whole point behind all of this is to really support those residents, identify the gaps and support those residents who don't always get support. So I would argue that I think there's real value in every single one of these, but it works together in a huge jigsaw puzzle of support for our residents.
Right, I'm getting lots of hands. So, Ryan, did you want to add any more in the answer to this question? Or was it something else you wanted to speak about?
No, it's just to support Laura there, really 100%, because the value to some of this support is unmeasurable to the receiving person. So whilst we have got some areas we can see that we've invested X, and as a result of X, we've got Y, and it's had a positive impact on monetary value coming into the county. Some of this, you won't see the benefits for years to come. And we've all heard the story of the resident that used to use a food bank and is now donating into those food banks to support people. So whilst we don't fully understand in some of these projects, the monetary income it's brought right away. It's the value and the social value to the receivers and the better quality of life they receive, which sometimes is hard to put a money value on. But of course, at the end of this project, we will be doing a review to try and see how much additional support, how much additional funding the £2 million investment has produced. So it's on the radar to measure that, to see the success of this project. But there will be some of the projects where we won't see that financial value, and we just know that it's had that positive effect on those residents on years to come.
Okay, thank you. Andrew, you wanted to come in as well?
Councillor Hope's answered in general terms. I just think just to give you a specific example on the homeless support, just getting that small, is that the whole concept of some people sometimes only 1 or 2 paychecks away from being in crisis. It's just they've been able to provide a deposit, for example, for a private rented letting. Can sometimes make the difference between somebody going to bed and breakfast, the point we were discussing earlier, going into bed and breakfast and temporary accommodation. So it's small, the relatively small investment, say in a deposit or rent in advance, a month's rent or 2 months rent, can save, to answer the question, can save 25, 30, 40,000 pounds a year to the council, let alone the social impacts on that family or individual. So I think that's as Councillor Hope said, we'll do the cost analysis of this, but there's already tangible savings, if you like, as well as benefits from that, from really small investment. So it's been very welcomed.
I certainly have a lot of empathy for that approach, because when my children were small, I was in that position, and I was lucky that my employer had a similar sort of scheme to help staff, even though I'd only recently joined them. And we would have gone under completely if it hadn't been for them. So I fully understand the importance and the benefit of these sorts of schemes. Right, I'm going on to my list. Bridget.
Yes. Councillor Bridget Bolwell, Bridport Ward. Just asking about Project 16 Children's Services, where it says 4 targeted priority programmes that support low-income families. It says there was potentially a verbal update around any support from the government on this.
Thank you. I'm very sorry. Apologies for not.
We should have put that on the agenda.
Yeah. Thank you for reading the report. With the very recent announcement with the Household Support Fund, I met with the officer that runs the Household Support Fund earlier this week, and they do anticipate that 3 of those 4 identified priorities for the children's projects will be able to be covered by the Household Support Fund, but they are waiting for sign-off on their proposals on how that fund can be spent. And then the 4th one, which was an additional, I think it was £20,000 into the holiday food and activities programme, can't be covered by that. So I anticipate that will come under this budget now. So we will be supporting that.
Thank you.
Thank you.
Derek.
Thank you, Chairman. Derek Beer from Shaftesbury. Thank you for allowing me to speak. And if I'm covering project items that have already been spoken about, I apologise, because it's soul destroying not being able to hear generally. But I'm having an MOT later in the week, so that should help it. I suppose I ought to declare a bit of an interest, because I'm involved with groups which do transport schemes and food schemes and whatever, but I'm not financially involved. I'm just there as a member.
You're not a member of this committee, so I think you're quite clear. You're okay.
Yeah, I won't be voting. I just have to raise concerns. I'm really pleased with the comment about involving local members in what's going on, because I find day by day I'm finding new schemes and people that are doing really good jobs, probably working in isolation. And if we could join them all together, that would be fantastic. What I do find, though, and I've found for months and months or years, is that people have great ideas. They set up schemes, and local charities are really keen to help and support, like Rotary or other charitable organisations, but they'll support new projects. It's supporting ongoing schemes to help social isolation, which is the real problem. Someone sets up and then they've got insurance problems, and massively so with community car schemes, community transport schemes. There are all sorts of organisations which will help schemes set up and go. But then to run them is an absolute nightmare for finding insurance and all the things they have to do to keep these schemes going. And they're really, really important. And I know of schemes where the people just said, we can't do this anymore. It's a nightmare. And that's a shame. So to maybe there is support, but I'm not aware of it, to help these organisations carry on their really good work. It's a nightmare.
So the purpose of the community transport funding for this year is really just for that reason, because we've identified that. So in our place directorate, we have a community transport team. They have a very tiny grant scheme because of the funding they have. It's very nominal to be able to offer schemes to start up funding, but it's obviously many of them are closing because of the increased insurance. Obviously, it's very hard to find volunteers. And through the Household Support Fund earlier this year, they gave them an additional £20,000 to offer extra grants out. So not for new, but for continuation grants. Now that opened up a phenomenal need because obviously many organisations supporting community car schemes came forward, as you would expect, and the £20,000 didn't go far enough. So we identified that as a gap, and then this fund is now extends that. So the main purpose of that fund is to support any organisations for community car schemes, transport schemes, who are struggling with insurance, the cost of DBS checks, volunteer costs, and those kind of things. So they can bid into that. To be able to extend that for a further 12 months.
Thank you. I wasn't aware of that, so thank you for putting me right, because that would be a great help. Thank you.
If you have any individual and specific car schemes in mind that you want to benefit from that, please either email into my team or the community transport team, and we can make sure it's put through in there.
I do have a relationship with the community transport team. I should have been aware, but thank you. That would be really useful. Thank you.
What you have raised is actually a fundamental point, because there is a real issue about core funding across the board. People are very happy to give grants for capital or for to deliver a particular project, but what they don't fund is the backroom cost of providing that.
So part of my team's core grant funds, so we have 3 core grant funds that were agreed nearly 4 years ago now. So we have one fund for projects, small projects for community, the Culture and Community Project Fund. We have another project grant fund for capital leverage. That's generally for capital builds and those things. So a small amount of funding from the council can lever in millions of pounds worth of community lottery funding or heritage lottery. And the third one is very unnamed Organisation of Revenue Support Fund, and that specifically is for core costs. And that fund is the one that's always massively oversubscribed. The organisations, when they bid into us for that, have to identify how they're going to support us develop our council plan for that. But we do always maximise out that grant funding. We tend to allocate it once every 2 years because of the oversubscription on it. It's a lot of administration for my very, very small team, but we do always make sure that those organisations that we're able to give that funding to, and quite often we don't always give them all the funding they ask for, but it's a contribution towards. But we are working on that. But we also work very closely with our colleagues in children's services, for example, who have a youth fund, who also offer core costs for youth organisations. So we make sure that if a youth organisation applies in there, they don't get double funding from our fund, because we want to make sure that Dorking Council funds will stretch for as many organisations as possible. But we are aware this is an ongoing problem. When I talk to my colleagues at Community Lottery, National Community, and so on, they are also changing their funds to make it much more appealing for and be able to include a lot more of the core costs rather than just the new projects.
Thank you. Thank you very much.
I've just got one last comment myself, and that originally came through from Project 11, the Age UK. And I'm very happy to see that in the update you've given us, that there is quite a spread now across Dorset. And I suppose my question is, not just for this project, but for all the projects, and I did mention this to you previously, is about ensuring that we don't have a postcode lottery in Dorset.
Yeah, absolutely.
That everybody across the piece in Dorset has equal access to all of these funding streams.
Absolutely.
And nobody gets neglected.
Yeah. I think one of our challenges with this fund is that we were very keen, because of the very, very tight timescales we have to deliver this, because really we're working towards that 21st of December deadline, is to really try and work with organisations across the Dorset Council area who are already delivering this in some kind of capacity. And of course, unfortunately, there are, in some areas, there isn't, a large group of organisations, a large organisation that will deliver this, which is why we've been able to pull on our partnership with Citizens Advice to be able to offer kind of a benefits kind of first aid session for organisations that really wanted to upskill. So, for example, we've given, as part of their grant to the Island Community Action on Portland, we kind of said, well, we'll give you this grant, but we want you to deliver this section of it. And they said, we've got a volunteer who does some of this, but we would like some additional training. And so Citizens Advice are doing this as part of their support with us to offer that those volunteers who will then be able to deliver that out. So it's trying to make the system work as best as we can. But also we're always looking to build capacity within our voluntary sector. So actually by giving the grants out to a much wider area, to some of these much smaller organisations, we're hopefully trying to build the capacity to be able to offer this in the longer term as well. Because it is important. Citizens Advice obviously have a limit on what they can take, and they already deliver, huge amounts for us. But actually, sometimes it doesn't necessarily need a fully fledged caseworker. It is just a support with completing a form. But actually, there's a little bit of training that needs to go with that as well, because if the form gets rejected, it comes back as an appeal, and then that obviously takes longer, and the resident is then longer without the funding. So we're always looking to see where we can build capacity within the sector for this.
Always need to get it right first time. And I'm going to give the last word to Ryan.
Yeah, thanks very much, Chair. I just wanted to come back on that comment, and I think you identify a real good point. I think we're really grateful to the Overview Committee for identifying this gap in that project. And obviously, Laura and her team have gone away to find a solution to make sure that project could be delivered across the whole county. And just picking up on your comments around a postcode lottery, I think this fund's been set up to help all the Dorset residents. Yes, it's needs driven, and in some areas there's a higher need, but it is there to support the rural, urban, north, east, south, west of this Dorset county. So, we rely on local member input, local organisation input to help us identify the needs, the support, and we're going to continue that path and that thought going forward. So you're absolutely right to identify that. We really thank the Overview Committee, and just a reassurance that it's not postcode lottery. This is, need-driven work.
Okay, thank you. Right, I'm looking back at the recommendations, which was to review and comment on the investment, note the extension of the Household Support Fund, and note that the 1.5 million of the Cost of Living Fund has been committed. And about the balance of £500,000 could be transferred into the next financial year if necessary. I think we've chewed it all around. And are you happy that we've met the challenges in those recommendations? Thank you. Okay, so that is all of the substantive items on the agenda today. We now have the work programme, which I'm sure is something that's all at the front of everybody's mind. So if I look forward, our next meeting is in January, and that will be the budget meeting. And that will probably take, the budget discussion will probably take the whole of the meeting. So I'm not intending to have anything else added to that. We already have 3 items on the February meeting, and I have been asked if we could include birth to settled adulthood as part of our discussions on that day, because it's a really, really important issue about transitions. Moving on, you can see what we've got following that. Is there anything else that anybody particularly wants to see in our work programme? Or are you happy just to let it flow at the moment? Yeah. Okay. if I move on, we've also got the Cabinet Forward Plan, which is for noting. Then we scroll. The Shareholder Committee for Care Dorset, their forward plan. And then we have, to give it its proper name, the Shareholder Committee for the Dorset Centre of Excellence forward plan. So again, just for noting at this point, unless there's anything anyone particularly wants to highlight on those. So if that's the case, I will just say, because of my little notes here, that urgent and emergency care transformation has been added to the forward plan for our meeting in February, which wasn't on there last time. So if everyone's happy with all of that, item 11 is exempt business. You'll be pleased to know there isn't any. So therefore at 12:14, I will close the meeting. Thank you all very much for your input today.
Thank you.
And also to George here, who's diligently been taking all the notes of what we've been saying. So thank you all very much.
Thank you. Thanks.